The coronavirus outbreak has been relatively slow to spread in Africa, and some countries have started to lift lockdown restrictions. But as predicted by the WHO, there are fears that coronavirus infections could rise in the region. The UN agency has said countries should consider their ability to test and trace before lifting lockdown. The continent has so far conducted 1.2 million tests since the start of the pandemic. Well, joining us now to discuss more on this is Dr. Oluwaseun Akiyemi, a consultant public health physician at the University College Hospital, Ibadan. Dr. Akiyemi, it's good to have you on the show.
Thank you very much. I'm glad to be here.
How do you rate Africa's ability in testing for the coronavirus right now? Are we lagging, and should we be easing lockdowns at this stage?
Yeah, thank you. Yeah, presently we are improving in our testing capacity. The Nigerian Center for Disease Control is targeting 2 million testing over the next couple of possibly weeks, at least about 50,000 tests per state. But we are not where we should be. And I don't think this is the time to ease lockdown restriction. For us to ease lockdown restriction, there are 4 principal or very key important tests that we must consider. The first is that daily death rate should be on the downward decline. Then the new cases of COVID-19 infection should also be on the downward decline. Then we should have enough testing capacity and enough PPEs, that's personal protective equipment, to deal with future demand. And finally, we should be confident that if we ease restriction now, we are not going to have a second wave of infection or a second peak. So I think these are critical issues that we should consider. But in our own case, I don't think we can say with confidence that we have passed this 4th test. So I wouldn't subscribe to easing the lockdown restriction just yet.
Oh, well, some say countries like Lesotho, which was the last African country to record a case, is actually underreporting because of a lack of testing. Can we win the battle against coronavirus without mass testing?
Yeah, thanks for that question. It will be difficult to win the battle without mass testing. According to the Director General of the WHO, he said, you can't win the battle against the virus where you don't know where it is. Nobody goes to war without knowing the capacity of the enemy, without knowing what the enemy is coming with. So we need mass testing so that we can identify cases quickly, we can isolate, and then break the infection chain. And then it's also important so that we know how many people have this infection. Without mass testing, we'll just be living in denial at best, and we'll be pretending that all is well. We know that so many people may be asymptomatic, and without knowing this asymptomatic, these people that we say could be asymptomatic could be spreading it while they are asymptomatic. So it will be a dangerous thing to ease lockdown when our testing capacity is not optimal, and to win the battle without testing, it will be difficult. So testing, according to the WHO, that's what we should be looking at now.
I'm glad you mentioned testing capacity. What other measures do you think we can take to bridge the gap in testing capacity?
Well, you know that some countries are trying to make the best of what they have in the face of scarce test kits. Countries like Ghana, Germany, they are doing full testing, although that has its own drawback because there might be high false negative result. But we should also be looking at indigenous capacity. How should we strengthen our research institution to produce maybe indigenous test kits? That's one thing we should be looking at going forward.
All right then, Dr. Oluwaseun Akinyemi, a consultant public health physician. Thank you so much for speaking to us on Network Africa.
Thank you very much.